is we are hoping to close on some land soon and build a new office where we can have some expanded services, where we can do really kind of grow the vision that we have for our practice. And what our vision is that we want to be able to take care of women from their medical needs, from their surgical needs, as well as for their aesthetic needs, and just kind of feeling better about themselves. So hopefully at some point within the next year and a half, we'll have a new facility. We'll have the weight loss clinic that's going to be part of it, probably attached to us. We're looking to expand with another gynecologist. We recently hired a nurse practitioner that'll probably be starting in the next few weeks to help us as well. So hopefully, as we continue to progress down the line, we'll be able to kind of take care of more and more of your services, and we'll be able to give you guys and listen to what you guys need so that we can be better providers of that. So just to review a lot of the things we do, because I know we do a lot of things and everybody gets really confused. We don't deliver babies anymore. I think everybody kind of pretty much knows that. I'm a board certified urogynecologist. What that means is that I specialize in women's health issues, especially their pelvic health, for women who have issues with bladder prolapse, uterine prolapse, and those type of things. In addition, we do a great deal of cosmetic surgery. I do a lot of liposuction, tummy tucks, breast augmentation, arm lifts, breast lifts. We do cool sculpting. We do something called fat transfer, which we'll talk a little bit more about. That's where we lipo areas. And then we take that fat and we put it in places that people want. So the two biggest places that we probably place fat is in the backside, and we also use it for the face. And Dr. Owens will talk to you a little bit more about some of that. But just kind of wanted to do that and open the floor for Dr. Owens to give her a little talk about what she's been specializing in.
So thanks all. Thank you all very much for coming and enjoy the margaritas. That was our greatest thing. Y'all are great for us, and because of you is why we're here, and so we greatly appreciate you coming. As Dr. Gonzalez said, facial fat transfer is what I'm starting to specialize in, and everybody wants a beautiful face and a beautiful behind, so we think that we can do all of that. Facial fat transfer has been out for a while, and actually people have used it in the past, cosmetic surgeons and plastic surgeons, for facial deformities, for patients that were born with birth defects, automobile accidents, and they see how well it works, and so now it's used more for cosmetic fillers as opposed to using Restylane or Juvederm to fill the face. Gives you a more natural effect. It's actually made from your own body, so it's what's called an autologous factor, so you won't have any reactions to it. So you don't need to do any skin testing or anything. Gives you a more natural look, a more natural feel, and in a majority of patients it even lasts for up to 3 years. So there's a lot of good qualities about it. I was just going to show you a few pictures about it, okay?
3 years.
So let's see. This is control computer 101. So you can see these are some before and afters, and y'all can come by later and see. And you can see mainly in this lady what was filled is what the next slide will kind of tell you what goes on with our face as we age. And everyone thinks that they need a facelift, and I'm just going to tell you why the majority of people don't need a facelift and what they really need. So our faces when we're born are nice and round because we have nice muscle structure, nice fat tone, and as we age, our muscles thin, or what's called atrophy. The fat goes away in our face, goes other places, but that's why we get the sunken in cheeks and look like the hollowing underneath our eyes, and that's just from the dropping of the fat and the deflation. So we start out nice and youthful like this, and then as we age, we kind of look like this. So smoothing out of the wrinkles. Dr. Fournier is one of the pioneers actually of facial fat transfer, and he's known for saying a millimeter of change in the face is worth a kilometer of change in the heart. So when we look in the mirror doesn't lie. What we see is what we feel about ourselves. And so today I'm going to show you how to feel better. So this is the lady. The truth is in the mirror. This is what I say when I look in the mirror. That's odd. Those wrinkles weren't there yesterday. Where did they come from, and how am I going to get rid of them? I usually don't put on my reader so I don't have to see them. So fat transfer, you can see in this lady, her crow's feet, how they're smoothed out with the fat in this area, how her cheeks give that more apple appearing cheek. You see how this cheek is kind of dropped, and how this crease right here is filled with fat. So that's the change that you get.
That's the same lady?
No, this is not the same lady, but this is the structure that gives her that look. So before I go any further, when ladies do come in, they want facial fat transfer. In order to get them where I believe that they need to go, I have them bring in their youthful pictures, like when they're in their 20s. And then I have them bring in their pictures when they're in their mid-30s or 40s. and then whatever their picture is now, to show them what their facial structure is actually like and where it needs to go. And then they can see some of their areas, because, you know, I'd like to look like a lot of different people too, but I don't have the facial structure to look like those people, so you can look like what you look like youthfully, not necessarily like someone else. So it just shows you, you know, what you need and where you need to be filled. So what are the benefits? It's kind of like what we talked about before. Fat that's transferred to the face can last as long as 3 years. And it's a very cost-effective procedure because you can actually have other areas of your body lipo. You can have body sculpting, and it can be added to different procedures, you know, at the same time to make it more cost-effective. And there's absolutely no chance of an allergic reaction because it's your fat. It's like if you were to take out your blood, have a surgery, need a blood transfusion, they put your blood back in your body, so there's no chance of a reaction. So what it does, like we reviewed the other patient, it plumps actually your facial features. It's an alternative to other wrinkle treatments, like we talked about, Restylane, Juvederm. It's safe, natural, and non-allergenic, just meaning, once again, that you won't have an allergy to it. And you recontour your face by adding definition to your face, recontouring your cheeks, you know, so you don't have that, what looks like the curtain closing, like the drape effect, you know. When you put fat in your face, it brings it up, flips it up that way. So if you've been wondering about how to get rid of your wrinkles, fat injections may be your answer. So we do private consultations today if you guys would like. Thank you.
So for everybody